application of hormone drugs and fluid therapy in large animal practice that will be conducted by Dr. Subramanian Sivaraman, Assistant Professor, Department of Clinics, Veterinary College and Research Institute, Tamil Nadu, India.
Good afternoon, everyone.
Abdul, subject is wrong.
So, good afternoon to everyone. So, respected practicing veterinarians and my dear students. So, first of all, I would like to thank Professor Nishan for giving me an opportunity to come here and participate in this clinical training program. And this is my third visit to our university. So I'm very glad to see you all. Most of us are familiar faces because many of us are my students who came for extensive program, and now we are doing your practice in your area. So I congratulate you all. So regarding this today's topic is the indication of common drugs and fluid therapy in buffaloes. Buffaloes means ignore that buffaloes. It is a large animal practice. Just it's for the workshop they put it as a buffalo. It's for large animal practice. So after a few slides, one or two, since you had a very good lunch, after 5 or 6 slides, you will be feeling sleepy and you will sleep. I hope so. So this topic is a very basic topic. Already morning they would have given you the a list of clinical procedures. So you just go through the practicing veterinarians and also students. You just go through that procedures in small animals. I think 20. That's no need. Now here we are concentrating on large animal. 30 procedures are there. That is the actual thing you have to learn before going to the internship. I mean, for any internship program. So when you start the day one to practice, you should know about that 30 clinical procedures so that you are ready for starting your learning process. That is like a kindergarten, LKG student, kindergarten or first standard. It is like a first standard class. So clinical examination and clinical procedures are a first standard class. You have to get know about all these procedures. Then only you are ready for learning the further things in our practice so that you can talk about many things. So in large animal medicine, it's like a ocean, like a Down syndrome, metabolic disorders, clinical management of toxicological diseases, hemoprotozoan diseases, management of hemoprotozoan, gastrointestinal disorders, and large animal basics itself. It will take more than a day, being a day. Morning, I used to start from morning 9 o'clock the session. It will end up by 5 o'clock or 6 o'clock for entire large animal practice. The next day, the other toxicology and other things, small units, 2-day program will be there, 2-day continuous program. Then only we can able to at least complete somewhat in the large animal practice. So this is a very basic one. So why I am telling again, many of you may be using this dress, you may not be using this dress. So these are all commonly available in our surrounding area, so we can use it effectively in our practice. So everyone knows, as a veterinarian, is a basic drug we will be using everywhere, and you should know when to use this calcium and how to use and where to use. This is a very important thing. We will be using calcium monohydrate mainly in cases of milk fever alone. Especially most of the 80 to 90% of the cases, you will be using only in milk fever alone. Other than that, there are many other things are also. Suppose, for example, the estrus induced during the time of estrus also the hypocalcemia occurs. Estrus induced hypocalcemia or motility disorders. Sometimes the animal may not be passing the dung. In such a conditions also, you might be able to use this type of calcium. So you should know how to administer these drugs. and without any untoward reaction. For example, this calcium can be given intravenously, subcutaneously, orally. Three routes you can give. I mean, orally means oral syrup preparations are available that you can give. So, injectable preparation you can give IV and subcutaneous. IV means unless otherwise you know the specific cause. For example, you are treating a case of hypocalcemia. If it is a recurrent animal or lateral recurrency, then you can go for IV injections of calcium without any untoward reaction. If it is a hypocalcemia. So in first stage of milk fever, if the animal is standing, the animal is not passing the tongue. If you want to give any calcium, you have to think twice whether you can give calcium to the standing animal or not. Then you have to go for the decision. You should not blindly give the calcium to the standing animal. So first stage of milk fever, even oral administration of calcium itself will recover and the animal will become normal. Or in any other conditions, the farmer will be sometimes many farmers they will insist you to give calcium immediately after calving. So you should not go for IV calcium to standing animals. It cannot be a same case all the time. So if the animal is palatable, I mean able to drink water, everything, you can administer oral calcium is more than sufficient. And subcutaneous calcium, half dose IV, half dose subcutaneous, you are giving the milk fever for preventing the recurrence. And orally, for increasing the milk yield or the routine for follow up and all, you can give the calcium syrup and all. So whenever you are giving calcium, the speed of the calcium should be very slow in that. You should not give it very fast. You should not hurry it and you have to go for another thing. You have to give it drop by drop for more than a period of 10 to 15 minutes slowly. And you have to warm up the calcium. Before giving the calcium, if the animal is recommended, if the animal is standing, you are giving for motility reason, no need to warm up. Only in milk fever cases, animal is having subnormal temperature, you have to warm up the calcium bottle and then you can give it so that you are bringing to the normal body temperature so that the calcium will be absorbed immediately. That is advantage of warming it. So in case of treating milk fever, you will be treating with the calcium borogluconate and you will be giving half dose IV and half dose subcutaneous. That is the ideal one. Don't give full bottle IV so that the animal will get up immediately. After sometimes the recurrence will be there. So the animal will go down. So to prevent recurrence of milk fever, you have to give half dose IV and half dose subcutaneous. And always prefer plain calcium borogluconate in your treatment. If it is a case of milk fever, animal is in severe recurrency, subnormal temperature, then turn towards the lateral flank. All these things are signs of hypocalcemia. So here, don't go for magnesium. You are having magnesium solutions. Magnesium and the calcium solutions are available. Only if there is any tetany, you have to go for magnesium solutions. If the animal is flaccid, dull and depressed, I mean a comatose stage, you have to go for plain calcium borogluconate. That is the better one for treating the milk fever. So the dose is intravenous calcium 2.2 gram per 100 kg per weight. That is why they have designed it for 450 ml bottle so that they will deliver 10 gram of calcium per cow. So when you should not give calcium, that we have to keep it in mind. So increase the sensitivity to calcium occurs in case of septicemia, hepatitis, mastitis, or suppose in ketosis or any other condition, any other hemoproteasome disease or anything. Suppose the animal is suffering from hemoproteasome disease and animal is recurrent. The recurrency is due to anemia. So in such a cases, you may be thinking that animal is lying down, you will be giving calcium. Because of sensitivity to calcium, the animal will sometimes it may collapse. Suppose sometimes same thing in septicemia and hepatitis also, the animal will collapse immediately after giving parts of calcium. For example, you are taking a case of acidosis, ruminal acidosis. The animal is recurrent. So you have to treat it for acidosis only, not for the recurrence. So if you treat it acidosis, the animal will get up. You understand the point? So in such a cases, you are giving calcium, the animal will collapse. So clinical examination and clinical diagnosis should be there. Then only you have to go for. For example, you are treating a case of ruminal acidosis, you are correcting it, the animal will become normal, feeding and everything is resuming, but the animal is not getting up. Then you can go for secondary hypocalcemia treatment. You can go for this. When subcutaneous injection, you have to give only, for example, 50 to 120 ml in an average site. Don't go for 250 ml in a single site. Multiple sites, 150 ml, 150 ml, like that you can divide it and get. So the calcium dose you have to give at the rate of 10 to 15 minutes, and IV calcium will be in the system for only for 6 to 8 hours only. Again, you have to repeat it. After recovery, you have to give for oral calcium so that animal will take the calcium and it will maintain the homeostasis. So the market available is 23% of the calcium boroprotenate is available in the market. It will be delivering 10 gram of calcium. So now regarding this thing, suppose as a learner, as you are a student or you are a nurse practitioner, you may not be able to give a content of calcium to animal this to avoid untoward reaction. We can mix the calcium in normal saline and milk. There won't be any cardiac activity. Okay, you mix some 200 ml or 300 ml of calcium boroprotenate in a saline bottle, normal saline bottle, and give it drop it up. Don't fast, give it fast. You give it a drop it up so that the cardiac arrhythmia and all you can prevent to some extent. After learning the things, you will understand which case and all, then you can manipulate accordingly. So learners, you can do like that. Then the oral calcium and all, these are the preparations available, calcium chloride and calcium propionate. These two things are available in the market, so we can really use whichever is available according to the commercial trade name and all. So calcium propionate will be available as a powder form also. As a syrup also available, as a powder form also available. Those who are having more number of animals, you can use the powder form also because it contains calcium as a propionate, propionic acid. So this type of calcium propionate can be used in case of hypocalcemia and also in case of ketosis also, propionic acid. So they will supplement energy. So for an energy purpose also, you can use this type of preparations very easy. And the next thing is the phosphorus. The most important thing in our clinical practice, in large practice, is the phosphorus. So many of us will be routinely using this phosphorus for your practice, and you will be using in which conditions you are using phosphorus? Pica. Then mostly you will be using in the infertility cases, repeat breeders, or unwisdom, or infertility cases also you will be using this phosphorus. Then any other? Just I want to know one answer. Any other disease conditions you would have tried? It will be it will be there. See here you can able to see the coffee colored urine, and this is a normal urine. This coffee colored urine, immediately you will be thinking this is a case of babesiosis. So in babesiosis, it's okay. Coffee colored urine will be there. Temperature or subnormal temperature or normal temperature with the coffee colored urine will be there in babesiosis. Then it will become anemia in such a clinical science will be there. Feeding habit, everything is normal, but the animal is passing coffee colored urine. Buffalo or cattle is due to hypophosphatemia, low phosphorus level. It is also called as postphosphatemia hemoglobinemia. So, but the term does not have it. It is only after calving. It may occur at any time. So you need not there is strictly to the postphosphatemia hemoglobinemia alone. Even in the pregnancy or any time of lactation, the animal will be having this coffee colored urine that is due to phosphorus deficiency. And all downer cows, they will be low in phosphorus. All downer cows, they will be low in phosphorus. So in case of treatment of downer cows, you have to go for supplementation of phosphorus. It is highly essential for the success of the treatment. So in the market, there are two types of phosphorus are available. Many times we were unaware of that for many years. After the elaborate reading only, we came to everything. And these two types of phosphorus are available. One is the organic phosphorus, another thing is the inorganic phosphorus. Organic phosphorus means you have to see the content. Some the pharmaceutical preparations, they will be telling you this is effective for postphosphatemia hemoglobinemia, and this is effective for infertility, this is effective for unwisdom, like that. Everything they used to put in the literature. But inside, if it is mentioned as butaphosphone or choline, so it is mentioned it is an organic phosphorus. So the ruminants require inorganic phosphorus. Cattle, buffalo, they require inorganic phosphorus. So the inorganic phosphorus is nothing but sodium acid phosphate. So what we have to give is a sodium acid phosphate. Previously, instead of sodium acid phosphate, we will be giving the other preparation like butaphosphone, choline, which are available as a 30 ml vial, and you will be giving for those hypophosphatemia downer cow. We won't respond to your treatment. So that is the main thing you have to keep it in the mind. So whenever the content is having butaphosphone, choline or anything, they are not at all useful for correcting the hypophosphatemia. Then why the pharmaceutical companies they are marketing this preparation? It is like a metabolic activator, metabolic booster. For example, a ketosis, you are treating a case of ketosis. You are giving this as a metabolic activator. Like in supportive therapy, B complex you are doing now, the same thing you can use it as organic phosphate. For ruminants, you need only inorganic phosphate, that is sodium acid phosphate or dihydrogen sodium, I mean orthophosphate. It should be a monobasic or dibasic. It is effective in correcting the hypophosphatemia, and you can see the wonderful result, excellent result you can be able to see. See, this is the sodium dihydrogen orthophosphate. It will be available from the shops. Laboratory grade or analytical grade can be you can get it and you can use it as 100 gram to 120 gram BAD orally. I mean, you have to mix it in the drinking water and you can give the animal drink. If the animal is drinking, you can mix it in the water. Or otherwise, you mix it with some water and drench it. That's all. There are two types of delivering this drug. So nowadays, there are many commercial trade names are available. Sodium acid phosphate commercial trade names are available. I think here it won't be there. So in future it will come. So you can use it IV also and also orally also. IV means 60 gram in 200 ml NS, mix it and give IV. The disadvantage is that when you give IV, it will rapidly reaches the peak level within 2 to 4 hours and it will come down immediately within 2 hours. So instead of giving IV, better you can go for oral administration, which will be there in the system for 24 to 48 hours. So which is the ideal one? Giving oral phosphorus supplementation is the ideal one. So always we prescribe sodium acid phosphate orally. So you prescribe a 500 gram pack, 100 gram morning and evening for 2 days, followed by 100 gram daily for 3 days. Means excellent result will be there. You can cure the hypophosphatemia cases, down cow cases, post-phosphatic hemoglobinuria, everything will be cleared within 2 to 3 days. This is the difference you have to keep it in mind. The next thing is the potassium chloride. Many of you have not used this till now in your practice. This is mainly indicated in case of hypokalemia, downer cow treatment. So downer cow means will be thinking in our mind default as only calcium. Not only calcium is not calcium is indicated only in case of milk filler, not in other cases. Other than that, other than calcium, the other components which are very essential is the potassium and the phosphorus. So already we have seen the phosphorus, how to give phosphorus. Next is the potassium. So the route of administration is two routes are available. I mean IV administration is available. Another thing is potassium chloride as oral. I mean powder is available, you can give it orally. These two things are available. When you are going for IV preparation, see this is hypokalemia. The animal is in the lateral pregnancy. Already you are given calcium, the animal is not getting it. You will be treated with the calcium, phosphorus, fluid therapy, B complex, everything, but the animal is not getting it. Neck muscle weakness is there, animal is in the lateral pregnancy. This is a hypokalemia. So one of the reasons for hypokalemia is prolonged anorexia, indiscriminate use of isoflurane. One injection is available in the market, but I think you are not having still now. There are different. I will tell about the corticosteroid. The isoflurane is a corticosteroid, which is a potent mineralocorticoid. It is safe in pregnancy. All corticosteroids are not safe in pregnancy, but only one thing, isoflurane is safe in pregnancy. Because of this advantage, people started using indiscriminately. If you are using isoflurane indiscriminately, that will lead to excretion of phosphorus from the urine through the kidneys, and I will go for hypokalemia like this. So you should not use isoflurane more than 1 or 2 days. Even in future, you are getting this. So this is a hypokalemia case. See, the animal is in the lateral pregnancy. The animal will be having S-shaped neck. S-shaped neck will be also in the hypocalcemia. I mean milk fever. You are treating for milk fever, but the animal is not getting. Even after that, you have to think about hypokalemia, potassium chloride, potassium deficiency. The S-shaped neck will be there. That is a classical one. So the head turns toward the flank, and the animal may not be responding to any of your treatment. So the normal serum potassium level is 5 milliequivalent. Just by clinical signs also you can treat it. I will tell you how to treat it. Less than 2.5 milliequivalent per deciliter, I mean, it is a severe hypokalemia. 2.5 milliequivalent is a moderate hypokalemia. So sometimes you may not be, you will be seeing the cases at the doorstep of the farmers. You may not be able to see the serum level. By clinical signs you will be doing. If you are going for IV preparation, it is a must for seeing the serum value. Without seeing the serum value, you should not go for IV preparation. So you have to go for only oral administration. See, IV preparation, this is I will measure 10 ml ampule. 10 ml ampule, each ml contains 2.5 milliequivalent. 2.5 milliequivalent. The dose is 0.5 milliequivalent per kg per weight. 0.5 milliequivalent per kg per weight. For example, a 300 kg cow, it needs potassium supplement in 300 into 0.5. How much it will become? 300 into 0.5. 150. So 150 milliequivalent you need. Each ml contains 2 milliequivalent. 75. So you need 75 ml. You know the calculation, you need 75 ml. So how to give this potassium chloride? You have to take 40 ml. I mean not more than 40 ml. 40 ml of potassium chloride, mix it in 5 ml of normal saline, and you have to go give it drop by drop, slowly. For 5 ml, it will take more than 3 hours. That much slow you have to do. Just if you increase the speed, why I am telling you, this is causes severe cardiovascular. If you just increase the speed, immediately the animal will die. So that precaution is because it will not be mentioned in detail. Out of experience, I am telling you. So you should not leave it as a delivery like fluid therapy. Drop it off very slowly. So how much you have to give? You have to take 2 normal saline sachets, 40, you have to mix it, or 40, 30, you have to mix it, and you will be giving slowly. So it will take more than 5 to 6 hours for delivering 2 sachets. But the result will be excellent result will be there. But the disadvantages of these things: time consuming, risk for cardiac arrhythmia and all. So you need not to go for this risk, and you cannot wait for the case one day. So you will be going for oral administration of potassium. It's highly safe, advantageous, and very effective also. In IV potassium, immediate results will be there within 6 hours. Results will be there. It will take more than 12 hours. So you can supplement 120 gram of potassium chloride DAB. DAB means morning and evening for 2 days, followed by 120 gram daily for 3 days. Totally you are giving for 5 days. That's all. So the potassium level will be increased. The animal will become normal. The animal will get up with like a miracle, you can say. Like that, very excellent thing is done in potassium chloride. So this is available as a 500 gram packet, and you can use it for oral administration. So these things you should not give it for IV. You keep it fine. This preparation you should not. This is only mentioned for oral. Okay. Sodium acid phosphate you can give oral and IV. But advantages of oral I already told you. So you prefer oral administration. Sodium acid phosphate. So you use it for oral administration. Yes.
How you can share hypophosphemia from
Yes. Filter. So if you are not having any serum facilities for serum evaluation, in hypokalemia and all the neck muscle weakness will be there. Hypokalemia. So the animal will go for lateral deviation of the neck, lateral deformity and all if it is going below 2.5. And as already told, all downer cows will be having low phosphorus. All downer cows. So we can supplement the phosphorus orally. There is no issue. Without seeing the serum phosphorus level, you can supplement some 50 to 100 gram daily orally for 3 to 5 days. So after giving potassium, the animal will be trying to get up. Some animals may not be get up. So you have to lift the animal with the support and then gently massage and do the physiotherapy and all these things management to then the animal become normal. The next is ammonium chloride. You would have heard this about this ammonium chloride. It is used as an anionic salts. It is used as an anionic salts. 100 gram per cow per day for 21 days just before calving, just 3 weeks before calving. If you are giving 100 gram daily for a cow, you can prime up the cow to metabolic acidosis so that you can prevent milk fever. Understand the point? So many farmers they will be having some 50 animals or 100 animals. Frequently they will be getting milk fever cases. The reason sometimes they may be giving calcium till the last of the pregnancy. So you should not give more than 100 gram of calcium for any cow for prolonged period during the last trimester of pregnancy. In the last trimester of pregnancy, you should not give more calcium. If you are giving this, it should be less than 100 gram. Better avoid calcium in the last trimester of pregnancy. So ammonium chloride. What are the anionic salts? Ammonium chloride, magnesium sulfate. All these things are anionic salts. So So whichever is cheaply available in your market, you can get it as a iron salts and you can use it underground orally for 3 weeks so that you can prevent milk fever. And you can check it. I will tell you tomorrow how to check the by using pH. You can check it how it is affecting your milk. For example, you are giving ammonium chloride underground for 10 days. You want to check it whether the system has developed metabolic acidosis there or not. So that by simply using the pH paper, you can see whether the metabolic acidosis developed there or not. According to the pH paper, you can interpret. So I will tell you that. Then it is also used in case of prevention and treatment of urologic cases. For example, you will be getting urologic cases in sheep and goat and male animals. It's very common. For that, you can give 10 gram orally daily for and this for use as acidification in case of calves, sheep and goat. And in case of buffalo, you can give 200 milligram per kg body weight orally. It's very effective in case of. Then ammonium carbonate it is used as an expectorant. Sometimes we open that thing and we just keep it in front of the mouth. It is as a respiratory stimulant also it will be used. And some 10 gram orally will lead to the expectorant effect. And this boric acid will be using commonly, no need to explain in detail. You will be commonly using with boric acid with glycerin as applying for lesions in the FMD lesions. So boroglycerin paste you are applying now, same thing. In FMD lesions, you can use the any oil with the millet flour also you can use. That will also have a very good emollient. And as a 2% solution for 23 minutes for washing the eyes also you can use this boric acid. The next is the copper sulfate. It's commonly available in the clinical use and is used in case of treating enzymatic attacks. That's for awareness and putting this, even though it's a swear back. And also is used in case of esophageal group dysfunction. For example, the farmers they will be telling the cow is around 2 months old. Frequently, active alert, everything feeding habit, everything is normal, but frequently there is regurgitation through the nostrils. So it's a common complaint. So that is incomplete closure of the esophageal tube. So the rumen is developing. In such a time, the animal sometimes it may regurgitate through the nostrils or oral cavity. So you can supplement the copper sulfate, 5% copper sulfate solution, so that 60 ml orally for 2 or 3 days, so that slowly it will become normal. Or even you can give sodium bicarbonate solution, 1% sodium bicarbonate solution also you can give. I mean, just take a 1 spoon of sodium bicarbonate, mix it with some glass of water, drench it. So in 1 or 2 days, slowly it will better. So it is also effective in treating the dermatophytosis case, ringworms. So 2 teaspoons of copper sulfate can be mixed with the 2 ml of water and it can be applied over the skin lesions, dermatitis lesions. So dermatophytosis can be cured with this copper sulfate. So 5% copper sulfate solution is also used as a fungicidal and bacteriostatic solutions. It's all economic. In large animal practice, you cannot go for a ointment base. It's a cost in the lab. So you can use this type of solutions for the 2% solution can be used in case of dermatophytosis. See the lesions, the foot lesion is like erosions, no? It will start from the foot lesions. It will start from the foot and it will be ascending up to the thigh region or completely all over the body region. It's a dermatophytous congolensis, dermatophytosis. So you will be treating with this streptofenicillin or penicillin for a few days, 3 to 5 days or 7 days. And the actual application with this copper sulfate solution will be a very good effective. You can also apply sodium thiosulfate. I will tell you. You can also apply sodium thiosulfate. Sometimes you would have seen the lambs or kids walking like this with jerky movement. Hind weakness and they will be walking like this and the hind coordination will be there. This is nothing but enzymatic ataxia due to copper deficiency or SLEDAC. It's a nutrition deficiency. So that you can supplement copper. So all the 20 milligram per kg for sheep and 35 milligram per kg for goat. Slowly the signs will recover. It's enzymatic ataxia, SLEDAC. Next, you would have heard about this preparation, Creta, iodine. These two combinations are available in the market. Creta is used as anti-diarrheal, so non-specific diarrhea. So, for example, the parasitic diarrhea, you want to treat it with the specific cause. You will be treating with the oxychloroquine or albendazole, parbendazole, whatever the thing is. It's a non-specific diarrhea, which you can give as Creta, You can go for 100 gram orally, or you can mix it with the kaolin also. Pre-term with the kaolin, both are available. You can mix it 100 gram, and you divide it. You can give 50 gram DAP so that it will control the diarrhea. So pre-term and kaolin. So it is acts as intestinal astringent. It absorbs toxins in case of any intoxication and anti-diarrheal. 50 gram orally BAD you can give it very effective. And next is the magnesium oxide. All these things are available in the market. Only the thing we have to get it and you can use it in the relevant cases. That's all. It's an excellent antacid. Acts as a movement buffer in case of low milk fat syndrome. For example, the farmer is telling we are producing the animal, suppose for individual animal, it is producing morning 10 liters or 15 liters, evening 7 liters. But the milk fat percentage is not that. That is called low milk fat syndrome. So morning milk fat percentage will be, difference will be more when compared to the afternoon milk. So this is due to the lack of roughage, excess feeding of concentrate, rumen buffer is not maintained properly. So in such a cases, you can go for oral administration of magnesium oxide, 0.5 gram per kg body to orally, and you have to supplement more roughages. To increase the fat percentage, you have to give more roughages. Only when you supplement more roughages, the animal will chew it. During the time of the chewing movement, the animal will have salivation will be there. More salivation, rumen buffer will be there. More rumen buffer and mastication, acetic acid will be produced in the higher concentration. So acetic acid is a precursor of milk fat. So to get more milk fat, you have to supplement more roughages and split the concentrate feeding. And with that concentrate feed, you can mix the magnesium oxide as an antacid. You can also use it as a very good excellent thing in case of abomination analysis and also to create purgatory also. So it is also used in case of treating the hypomagnesemia, follow-up of hypomagnesemia. I mean 100 gram orally daily for 5 to 7 days you will be supplementing. The magnesium sulfate is very commonly available in all your practice, hospital or anywhere pharmaceutical preparations. Magnesium sulfate is available as a 500 gram fat and it is used as an anionic salt. I already told ammonium chloride is also an anionic salt. Magnesium sulfate is also an anionic salt, which is cheaply available natural magnesium sulfate. So you can use this one 150 gram daily for 21 days to prevent occurrence of milk. As a purgative, how much you have to give? Magnesium sulfate 500 gram, sodium chloride 250 gram. Mix it with water and drench it. It acts as a purgative, excellent purgative. Okay. So large animal, excellent purgative is magnesium sulfate with sodium chloride. And when you are giving as a 10% solution, it acts as a muscle relaxant in case of treatment of tetanus. So you are having magnesium sulfate 10 gram in 100 ml. Okay. You mix it and give subcutaneous so that you can act as a muscle relaxant in case of tetanus. So this animal is having tonic-clonic conversions. Tonic-clonic conversions. Nystagmus is there. Frothy salivation is there. It's a case of hypomagnesemic veterinary. So in such a cases, you can go for combined magnesium with calcium. Any commercial preparation is available, you can go. Other ways you can go for magnesium sulfate solutions, IV, so that you can treat it. So for treatment of hypomagnesemic veterinary, you have to go for 100 to 400 ml of 25% of magnesium sulfate solution. So whenever you are working in the field condition, the percentage is very, very important. So if you are using a saturated solution of magnesium sulfate, what will happen? The animal will die because of saturated respiratory aspects. So you have to ensure that percentage carries out. So 25% means you can use it IV or subcutaneous for treating the hypomagnesemia cases, or you can use the commercial preparations which is available readily for treating such type of cases. 20% of magnesium sulfate can be also used. If you are not able to give IV in case of sudden conversions, so you are trying to give IV, but the animal is not allowing, severe conversions is there. So in such a cases, what you have to do, you can take 15 gram of magnesium sulfate, mix it with 100 ml of saline, warm saline, or water, ordinary tap water, and give per rectum per rectum. So that immediate absorption will be there. So the animal will become normal in case of hydromelis. So then you go for IV preparation or water preparation or to stabilize that. So for immediate action, you can go for, if you are not going for IDSS, you can go for enema preparations also. 60 gram of sodium, magnesium sulfate in 200 ml of water and give the rectum. And externally, you will powder the magnesium sulfate and mix it with the glycerin and you will be applying over the any confusion, swelling, under fibrosis. All these things you will be using as an external application to reduce the edema or swelling. Magnesium sulfate with the glycerin, natural glycerin paste you will be using. And the second abscess treatment is, suppose you are treating an abscess, you are opening abscess, draining the abscess. You can mix the magnesium sulfate with the glycerin in a flask and keep it inside the abscess. And next day you can remove it so that all the hospitals should be absorbed. So many indications are that with a single magnesium sulfate drug. Magnesium chloride, as I already told, ammonium chloride, magnesium sulfate, and magnesium chloride. All are anionic salts. You can prefer anyone for preventing the milk fever. Among these three things, magnesium sulfate is cheaply available in the market, so that you can use magnesium sulfate for preventing the milk fever. Sodium chloride or normal sodium chloride we are using for cooking purpose and all. This is used as electrolytes in the oral dehydrating solution, and with magnesium sulfate as osmotic purgative, and as a hypertonic saline infusion in case of severe dehydration. For example, sodium chloride 7.2% is used in case of severe dehydration. You will be giving some 1 liter of 7.2% of sodium chloride solution IV, followed by oral administration. Immediate resensitization, one technique is that. Small, severe shock condition, a short way to where the animal is giving hypertonic saline solutions. Then sodium bicarbonate. This everyone will be commonly using in case of ruminal acidosis. So in the treatment of ruminal acidosis, as a 7.5% in case of acidosis condition, orally as antacids and rumen buffer, and 1% solution in the washing of FMD oral lesions. For example, FMD is that you can mix sodium bicarbonate in water and you can wash the oral lesions. And also to supplement the bicarbonate loss in FMD due to salivation. In salivation, that will be having salivation means that will be having bicarbonate loss will be there. So to counteract the bicarbonate loss, you can supplement this the sodium bicarbonate orally, 50 gram orally, so that effectively you can correct the bicarbonate loss. Then sodium salicylate. Anyone use this one? Sodium salicylate. It's an excellent in antipyretic and analgesic drug. It is effectively used in case of ephemeral fever outbreak. The EF outbreak is that in such a case you will be giving 50 to 100 gram orally. The same thing, sodium salicylate is available as an injectable now. Like many commercial preparations, Indian preparations, so many preparations are available there. So I don't know the trade name here. Sodium salicylate is an excellent analgesic and antipyretic, anti-rheumatic. So it is commonly used in case of ephemeral fever. Sodium iodide. This is also available in the market. Sodium iodide. Morning itself, Samsara told about the sodium iodide. It is used in case of actinomycosis. 60 mg per kg body weight IV once a week. It's injectable is available. If it is available, you can use it. Otherwise, don't get that sodium iodide and you get prepared. It should be prepared as a 6% solution. Otherwise, you should not prepare. It can be used in case of hard indurated udder, fibrosed udder, as an excellent recovery will be there in case of fibrosed udder, sodium iodide. Sodium carbonate is used for 2% sodium hydroxide, sorry, not hydroxide. So sodium hydroxide is used as a disinfectant in cleaning the shed for cleaning the FMD affected animals. Sodium carbonate also can be used. Sodium hydroxide can be also used. The dressing powder, iodoform boric acid zinc powder, zinc oxide, is an excellent dressing powder for the farm animals. For example, you can mix it in the combination. You can apply it over the wound so that you can have a low cost effect. You can prepare up your own dressing powders. Then formaldehyde, everyone will be having formalin. 10% formalin act as a hemostat. For example, recently covered you are getting a heme calcium, rose milk is there. You are treating the hemostats it is not getting recovery, the last option you can go for oral administration of 10% formalin. I mean 10 ml of formalin in 1 liter of water and mix it and drench it without any aspiration. There will be getting excellent results for inhalation. And the 2% formalin and the 2% copper sulfate can be used as an excellent thing for dermatophytosis. And 1% formalin can be used as a food bath. And 10% formalin as a preservative. For example, you are doing any postmortem, you are collecting any samples, histopathology samples, you can send it for preservative. Anyone use this one? Sodium disulfate? Anyone? Not yet. So hereafter we will be using many will be getting very number of cases. It is commonly used in case of cyanide intoxication. Cyanide intoxication. Okay. Hydrocyanic acid. So whenever we are getting a sugarcane tops, sorghum, maize, or even some plant beads, they contain more cyanogenic glycosides that will lead to severe conversions. Animal will have bloat, pupillary dilatation will be there. So when you go for any IV, when you put the IV in the tubular vein, you can able to get the blood with a brick blood color, like rose or a brick blood color. It will not be a normal color, it will be brick blood color. The mucous membrane will be brick blood color. So this is indication of cyanide intoxication, hydrocyanic acid. The only antidote, the treatment is the sodium acid. So there is no commercial preparation available in the market. Only the thing you have to get the thing from the shop, and the dose is 660 milligram per kg body. 660 milligram per kg body. You have to mix it with the normal saline and give it. So suppose you are getting a case, animal is having conversion, bloat, and everything is there. You want to give sodium disulfate. You cannot go and measure the 660 milligram per kg body weight. According to the animal 350 kg or 450 kg, you cannot measure it in the field, So approximately you take 250 grams of sodium disulfate. Of 500 grams means you take a half of the 250 grams in the hand and put it in a vessel and pour 1 liter of normal saline or 500 ml of normal saline, mix it immediately, and you will take it in a syringe and give it directly immediately. Or you connect it normal saline and infuse with that normal saline. That's it. So very easy method to administer. Immediately after mixing with normal saline, you can feel it will turn into ice cold. If you touch the solution, means it will be like ice cold. Okay, you need not worry about that. Immediately you infuse it with normal saline or directly you can give it with the IV. Within few seconds after giving IV, the animal will become normal. If it is a cyanide intoxication. So only it is always practitioners, they used to have this type of sodium disulfate in our hand, in our bag for treatment. Because after getting the case, if you are prescribing a medicine, they cannot go and get it and come. Meantime, the animal will die. So we will be having this type of whoever is a larger practitioner will be having this sodium disulfate ready in their bag. Suppose even if you are giving in suspected case also, nothing will happen. No need to worry about these things. So you need not wait for confirmatory diagnosis. You won't do any harm also. Methylene, I think everyone would have been used in case of recently. In case of LSD, you will be commonly used in case of LSD as a 1% solution, as 300 ml orally. Protein they are using. Apart from that, the main thing of methylene is it is commonly used in case of nitrate intoxication. Nitrate, the same thing like cyanide poisoning. Nitrate is also that in farm animals, mainly due to well water or sewage water, the border which is irrigated with the sewage water. The border contains nitrate, more number of amount of nitrate. So the animal consumes the border, immediately it will develop the respiratory distress, diarrhea. Sometimes the mucous membrane will become chocolate brown in color. These are indications of nitrate intoxication. So in such a cases, you will be going for methylene blue IV. So you have to go for 1% solution. That is a secret in that. So you should not just take the methylene blue and put it in normal saline. You won't reverse it. 1%. What is 1%? 1 gram in 100 ml. Like that. The dose is 1 to 2 milligram per kg body weight. 1% solution. Within few seconds, then you will become normal. So in cyanide intoxication, the mucous membrane will be brick red in color. In nitrate intoxication, the mucous membrane is brown in color. chocolate. This is the difference between these two. And next is the vinegar. Anyone use this vinegar? In case of urea and toxicity. Suppose the farmers they will be keeping urea for irrigating the paddy or anything field conditions. So they will mix it, or sometimes the animal will go and accidentally it will consume, or sometimes it will be contaminated in the water and it will get intoxicated. So what will happen? The urea when it is mixed with the water it goes around the snow. When it drinks or when the urea contaminated water the animal consumes, urea goes into the rumen and it will develop into ammonia. Ammonia is that means what will happen? The animal will develop severe growth, tympani will be there. So suddenly after drinking the water, the animal will develop severe tympani, salivation, and respiratory disease, and the animal will develop like the same thing like a rabies. Rabies is slow progressive signs will be there. Here sudden onset. So you have to think about any urea intoxication, and you have to drench it immediately. Vinegar 3 to 5 liters orally. Otherwise we cannot save that. There is no, you don't give time to go and attend the case. You have to tell the farmer immediately drench 5 liters of vinegar followed by some cold water. Then we go and treat it accordingly. And during the time of administration of this vinegar, never give antacids. No anti-growth preparations, no. Because animal will be having growth, never give anti-growth agents. In cyanide and also in this urea intoxication, never give anti-growth agents because all anti-growth agents contain antacids. So we are giving vinegar only to change the rumen pH to acidic. Again, if you are giving the antacids, your treatment will be a failure. I have seen many practitioners, everything they will do correctly, but to reduce the tympani, they will prescribe anti-growth agents. That should not be. So in cyanide intoxication and this one, urea intoxication, you should not give or prescribe anti-growth agents which contains any antacids. And it is also used in case of ruminal alkalosis treatment. Ruminal, like we are having ruminal acidosis, the same thing you are having ruminal alkalosis. In such a condition, you can give 1 to 2 liters orally. By seeing rumen pH, you can decide at that. And also in case of milk fat depression. So when you give drench orally some vinegar, the next day milk fat will be increased. But the disadvantage is corrosive. So irritation, the feed intake will be reduced. So you cannot continue for a long time. Cost factor. So you have to go for the feeding management. And next is the DMSO, diluted sulfoxide. So this is an excellent one multi-purpose use in case of equines. In horses, so many indications are that. The same thing in cattle also you can use as an anti-inflammatory, antioxidant. You can use it as a oral or topical or IV preparations. DMSO. All these are effective. Anti-inflammatory, antioxidant, analgesic, diuresis, and it acts as reduces the edema, confusion, inflammatory swelling. So nowadays we are getting in lumpy skin disease, nodules, no, ruptured nodules. You can mix 60 ml of powder iodine with 40 ml of this DMSO, and you can apply it over the lesions. Excellent result. Within few weeks, the lesions become normal. That is effective in having the penetration effect. So it can be used as an application of LSD wound and also in cases of any contusion, ligament problem, as an external application, all these things we can use. So parentally they will be using in case of equines, not in. So this is a nervous form of ketosis. So in such a type of ketosis, you will be supplementing propylene glycol or glycerin. So what we have to do here now, nervous form of ketosis, you are treating the ketosis parentally first by glucose solutions. So as a practitioner, don't go for 1 liter, 2 liter of dextrose solution. There is no need at all. Okay. I have seen sometimes many of them will be giving 2 liters of 50% dextrose, not needed. When you give more dextrose, the inhabitants will be there. It will lead to excretion of phosphorus, and will go for hypophosphatemia. The recovery will be poor. So the needed dose is 500 ml of 50% dextrose or 20% dextrose. 500 ml 1 liter can is enough, not more than that. Followed by oral administration of propylene glycol. It is available commercial in the market, or commercial preparations are available, or glycerin is available. You can give 220 gram DAP orally. It's an excellent good nutrition and you can use it for treatment of hollow of ketosis. As already we discussed, the calcium propionate and calcium, the sodium propionate, ammonium lactate are already glucogenic precursors for use in case of ketosis. A liquid paraffin, so internally it acts as a purgative. This is very commonly used in case of equines as a purgative. In large animals, the first preference of purgative is sodium chloride with magnesium sulfate. You can also give liquid paraffin also. Then as a mineral oil in case of frothy flow. For example, you are diagnosing a case as a frothy flow, you can give liquid paraffin. 5 ml to 1 liter orally. In case any other preparations are not available. If liquid paraffin is not available, in case of frothy flow, you can go for any vegetable oil. Any vegetable oil can also be given 5 ml to 1 liter water. Then potassium iodide and it is used in the case of actinomycosis. So 10 gram dose is 10 gram orally for 10 days. So if there is any slow progressive swelling in the mandible and if it is a hard in nature, we have to think about actinomycosis. And as already Sam told in morning, Samasa told in morning, it can be also used as a orally in case of iodine deficiency also. So here we have to use 10 gram orally for 10 days. 10 gram orally for 10 days. And also use in case of other fibrosis also. The activated hormone acts as a universal antidote in case of any intoxications like botulism, carbamate, or OPC poisoning. 1 gram per kg body. Nowadays, many commercial preparations are available. It is available as a powder form and also a liquid form. So whichever is available, you can use. It absorbs the toxins, and after administration of activated charcoal, after 4 hours, it gives a purgative so that the toxins will be eliminated. That is the ideal one. Sodium polyacrylate. It's a new one and it is used as a purgative. 10 gram is mixed in water and it will be mixed with the infusion pump only because it will come like a foam. They used to create artificial snow, no? The same thing. So it will be infused with the powder just for your awareness only. The whitefield ointment is an excellent one for dermatofibrosis. Benzoic acid with salicylic acid with the paraffin base, you can make it as a excellent for antifungal dermatofibrosis. Very good results. The next thing is the antibiotic. Just a usual till now we have seen about the common drugs. What are the common drugs we are commonly used in our large animal practice? There are few things just to enlighten it. So any in our large animal practice or small animal practice, judicial use of antibiotics should be there. The first thing. Then some of the things what we have to take and just I will and they go for the fluid therapy. And oxytetracycline commonly used in case of hemoproteasome disease. Whenever there is a rise in temperature, your selection of antibiotics should be above OTC, oxytetracycline. In case of hemoproteasome disease, the dose is 22 mg per kg body weight. In other cases, you can go for 5 to 10 mg per kg body weight. Don't mix it with the rigor lactate, mix it with the normal saline. In case of anaplasma or leptospira, oxytetracycline long acting is more than sufficient. So long acting is very effective. If you are getting IV, you see the preparation accordingly and mix it with normal saline give IV. Don't mix it with this dextrose 20% or rigor lactate. Then penicillin is commonly used in our practice. It's all effective for gram-positive organisms like black water, all these things, and this actinomycosis, actinomycosis, all these things. And the combination of streptopenicillin is used in case of Vetware also, and also it is used in case of foreign body syndrome, reticular abscess, so many things. It's a respiratory disease. All these things widely used. The second commonly used is streptopenicillin. Enterotoxin is commonly used in case of respiratory tract mastitis and other indications of skin and soft tissues. It's very broad spectrum antibiotic. Streptomycin is a narrow spectrum antibiotic. Okay. It's a commonly used in combination with other antibiotics, especially in case of mastitis and all. Sulfa-trimethoprim, 2 preparations are available. One thing is a IM preparation, another thing is IV preparation. IM preparation you should not go for IV, so that lead to anaphylaxis. IV preparation is excellent for treating the gastrointestinal, intestinal disorders, enteritis, especially bacterial enteritis. It's very excellent result you can get in the sulfa-trimethoprim. And the other things are amoxicillin with cloxacillin, ceftriaxone, ceftriaxone. Ceftriaxone is commonly used in case of respiratory tract, 1.1 mg per kg body weight. Tyrosin is indicated in case of mycoplasma, 10 milligram per kg body weight. And arbifloxacin, margofloxacin, all these things are already seen. The next is the NSAID. The common NSAID available for large practices: meloxicam, flunixin, chlorphenic acid, ketoprofen, phenylbutyrate. These are the anti-inflammatory drugs available in the market. So don't combine one more than one. I mean, two NSAIDs. It's not at all advantage. I have seen some practitioners when they are treating mastitis cases or reduce the saline, they are using two NSAIDs. That's not. And also don't exceed the dosage of. Don't exceed the dose. You can give it in the normal dose. I mean, specified dose. If you are exceeding the dose and you are giving for more than 5 days or 7 days, the animal then they will go for causing the dark tannic color species is indicative of abominable. So you will be getting the dark tannic color species, which is liquid in nature or semi-solid in nature or solid in nature. It is indicative of abominable. So you have to treat it with the pantoprazole. So this abominable ulcers, you can very well treat it with pantoprazole. So anti-ulcer drugs commonly used in normal practices: pantoprazole, ranitidine, oral administration of magnesium oxide or magnesium carbonate, 0.5 gram per kg body weight orally, and pantoprazole 0.5 milligram. I mean, for one animal, you can give 80 to 130 milligram IV. These are as a 40 milligram vial, 80 mg IV for 3 to 5 days. You can get a very good result. Oral supplementation of this magnesium oxide or magnesium carbonate, or you can supplement with aloe vera gel also. You can apply orally, so that the abominable ulcers will heal very easy. Then vitamin B complex thiamine is very commonly used in large animal practice. We are getting frequently colium from Malaysia cases. I mean, neurological signs exhibit in sheep and goat, which is having thiamine deficiency. You can supplement thiamine. So any B complex with liver extract should not be given IV. You have to give only IM preparation. Don't give IV. And vitamin E selenium you are commonly using in case of infertility cases as an antioxidant in mastitis also. Most of the cases, vitamin E more chances for anaphylaxis. So whenever you are giving vitamin E, always take care and keep it mandate as an antihistamine ready for use to counteract it. Then vitamin K is commonly used in case of infertility cases and reproductive disorders, and also in case of hypovitaminosis A. So is that they able to come, unable to stand up, or they able to click the lamp, whatever the thing, which is having incoordination, ataxia, unable to stand, and the head will be rotated in the 360-degree angle like this, means it's a clear indication of hypovitaminosis A. So there is no other anything, just to give vitamin A injection, 440 units per kg body weight, 3 to 5 days. Excellent result, then you become normal and walk. We can see many number of cases in the field. Just vitamin A supplementation will be more than sufficient. This type of lesions will be sometimes you will be coming across is vitamin C responsive dermatosis. So you can supplement vitamin C orally or injectable form also available. You can either give orally or injectable. It's in a cough. Sometimes you may mistake it as a mange and you will be going for ivermectin and all. No need. These are two conditions are there. One thing is the urine scan. Sometimes the animal lying on the urine also it will pass like this. It will pass like this. Other thing vitamin C responsive dermatosis. And chemostats, both of this adenochrome, monocytic tranexamic acid, and vitamin K or chemostat. These are agents which control the bleeding. For example, you are taking a case of epistaxis, uterine prolapse. All these cases are now to arrest the bleeding. You can use all this. Vitamin K1 is the naturally occurring form. K1, vitamin and sodium. Magnesium sodium is a synthetic vitamin. Commonly used electricity, furosemide, 2 to 4 milligram per kg body weight. So regarding corticosteroids, dexamethasone, prednisolone, methotrexate, isopropyl. These are all available in the market. Dexamethasone will be using for anti-inflammatory and also for termination of pregnancy will be using. Prednisolone, the treatment of large practice and the treatment of supportive treatment, I mean the treatment of ketosis we will be using. For one time we will be using steroids. Methotrexate is available in the two forms. One thing is a methotrexate succinate, another thing is a methotrexate acetate. Acetate is for intraarticular preparation. You have to see. Methyl succinate is for IV preparation. This methyl succinate is commonly used in smaller animal practice. So in not bother. It's in dogs we are commonly using that. And prednisolone is commonly used in dogs for immune-mediated disorders. That is it. Isopropyl, as I already told, is not available here. Future it is available, make ensure it's a potent mineralocorticoid and it's a weak corticosteroid. You should not go for indiscriminate use of isopropyl. So these are the things already we have seen. You have to keep it in our kit for emergency purpose like sodium thiosulfate, methylene blue, vinegar. Vinegar you can get it immediately, you may not keep it immediately. Atropine sulfate should be there. Adrenaline, antihistamines, furosemide. These are all the things we should have in our practice for emergency kit. So I will having open mouth breathing. So what the thing is aspiration pneumonia. So in such a cases of aspiration pneumonia or pneumonia cases, you can go for nebulization. This type of nebulizers are commonly available in the medical shops. You can get this nebulizer. It's a cost. It's a very low cost only. 1,000 to 1,500 or 1,500 to 2,000 is available. So you can get these things and you can go for nebulization. And you can use budesonide. This is a component available for human use. You can use 2 to 3 ampules inside. You can pour it and you can give it the nebulization. In LSD cases, in case of cough and all, very severely affected LSD cases with the cough pneumonia, we have done many number of cases and very successful treatment have been done with this type of nebulization. And salbutamol or ceftriaxone anything can be added. Apart from that, with the saline also you can give. Budesonide with saline also you can use it and give as a nebulization. The next is adrenaline. So just give 1 or 2 ampules in your hand for emergency purpose. That's all. Whenever the animal is having any anaphylaxis, suppose for example you are giving oxytetracycline or sulfatriazole or any injection, suddenly you will get anaphylaxis. Reaction should be there. So eyelid swelling will be there, perennial edema will be there, puffiness of the eyelids, urticaria will develop all over the body. So immediately you have to give antihistamines will be given. If it is very severe, then you can go for adrenaline. So it is available as a 1 ml ampule. So you mix it with 1 ml adrenaline, mix it with 9 ml of normal saline, and give 0.1 ml per kg body weight. Subcutaneous. Even if you are not able to give lightly, you can give just subcutaneous also, followed by parental appreciation of antihistamines. Okay, then corticosteroids if it is needed, or then bronchodilators. You need not go for corticosteroid in all the cases. If it is a pregnant, you can avoid it and you can just revive it back with the chlorpheniramine and anaphylaxis with this adrenaline. To have any very good effect in case of anaphylaxis, we always combine the H1 with the H2. That is the main thing. H1 means chlorpheniramine. H2 ranitidine. If you give chlorpheniramine 20 ml, ranitidine 20 ml, it will be the effect will be more. You can get the success rate will be more. So H1 and H2 can be combined effectively. And you would have heard about this N-acetylcysteine is commonly used in case of human being. During the COVID season, you would have seen they would have prescribed this. It's a mucolytic. It is available as an injectable form, and you can give it as a. This N-acetylcysteine can be also given as a nebulizer also. With the NS, you can use it and give it as a nebulization. Or whenever there is a cough or a lamb or a kid who is having severe mucolytic, I mean mucus secretion is there, it acts as a mucolytic. You can go for intravenously. Acetylcysteine can be also given intravenously. It is also used in case of paracetamol toxin in cat. The fluid therapy, this is the rapid IV infusion set. So, this normally we are using the IV set now, that is indicated as a normal conventional, let's say human IV set. This is indicated as a large animal IV set. So this gives a rapid infusion of IV within 1 minute, it will deliver 1 liter of fluids. So if you want to deliver 5 liters, it will deliver in 5 minutes. That's the advantage of this fluid, this rapid IV infusion set. Before going to the fluid therapy, just I broadly enlightened. Fluid therapy is a very big topic that will take more than 1 hour or 2 hours. Just to understand, I am telling broadly. Among the body, in the body, 60% is the water. Remaining 40% is the tissue. In that 60%, 40% is the intracellular fluid, meaning inside the cell. 20% is the extracellular fluid. In that ECF, two things are there. Plasma is 5%, interstitial fluid is 15%. So where we are going to manipulate now, you are doing the fluid therapy in the plasma. You are doing the plasma. And in the IV, you are doing the IV. So it is going to the interstitial fluid. I mean the ECF. From the ECF, it is going to the intracellular fluid. So different compartmental movement is there. So it will go on slowly. It will have correctly degradation. So you must understand this thing. Then other things will be easy for you. The assessment of dehydration, 8%, 10%, 12%. Normally, every animal will be having 8% of dehydration, all animals. So you can give fluid therapy for all animals. The exception I will tell you, whichever animals you should not go for fluid therapy. Severe dehydration, moderate is 10%, severe dehydration 12%. So three categories you can differentiate by using the skin testing test and the sunken eyeball, and you can assess the dehydration. Among the laboratory value, you can by seeing the PCD. If the packed cell volume is increased, it indicates dehydration. If the packed cell volume is decreased, what is the indicator? Anemia. If the PCD is decreased, it is anemia. If the PCD is increased, it indicates dehydration. There are different types of fluids available in the market. There is crystalline fluid, colloidal fluids, amino acids. As we have seen calcium, phosphorus, and potassium. So we will see from the first three things: crystalline, colloidal, and amino acids. Colloidal fluids, dextran, metastarch, hydroxyethyl starch. All these things are colloidal fluids. So the natural colloids are whole blood or RBC or plasma. See, this is the plasma volume expander. I mean the dextran or when you are using this plasma volume expander, can you use this for correcting dehydration? No, you cannot use it for dehydration. It is corrected for plasma volume expander. For example, you are attending a case of hemoprotozoal disease, dialysis. The animal is anemic. You are waiting for the blood transfusion. You are not getting the donor. You are waiting for such a procedure which to enhance the plasma volume, you can go for this type of temporary solution. So plasma volume expanders. It will not correct the dehydration. So hydroxyethyl starch. Crystalline solutions are normal saline, lactate, and the DNS, dextrose, all these are crystalline. What we are commonly used in our practice is the crystalline solutions. So any drug you can mix it with only normal saline. That is the ideal one. Don't mix it with the oral. Always prefer a normal saline and don't mix any solutions with the 20% or 50% of dextrose also. So this is a rapid IV infusion set. And you can go for, you should not give calcium, potassium, dextrose in this IV set. Okay? Then what are the things you can give? You can give only normal saline, lactate. Except that, you should not go for any other source. Like if you give calcium in the rapid IV, cardiac calcium. Potassium cannot give. Dextrose, it will lead to hypophosphatemia. So these things are not for sodium bicarbonate. In case of ruminal acidosis, you cannot go for sodium bicarbonate rapid IV because rapid alkalinization will lead to collapse of the animal. So for massive fluid therapy in large animal, you can use ringer lactate with this type of rapid infusions. How to calculate the dehydration? This is a formula. Percentage of dehydration into body weight into 1000. It gives the ml of fluid required, how much you have to give. So that we can assess how much of fluid they can able to give. So, for example, the ECF requirement, for example, we are getting a value in that the ECF requirement is 1/3 of the required fluid. From the required amount, 1/3 is the ECF requirement. 1/4 is the plasma requirement. Immediate requirement is the 1/12. So just for example I am telling, so that you can evaluate how much we are giving fluids. For example, animal is having 10% of dehydration, 300 kg body weight. You are calculating, it is coming around how much? 30 liters. So can you give 30 liters for animal? No, it's not practically. In equine they used to give. In equine they used to give for polyps and all. So the ECF requirement is 1/3 is the ECF requirement. That is 10 liters. The plasma requirement is 2.5. Do you know why we are giving the required amount as a 3 liters and all? So we will be giving 3 to 5 liters and all because we are correcting the plasma requirement so that the system will correct it slowly, or we will be giving at the evening so that it. Thumb rule is 10 to 20 ml per kg body. The thumb rule is 10 to 20 ml per kg body. So for 300 kg body it means 3 liters. 3 liters to 6 liters of fluid you can give. Suppose animal is not passing the interception, GA disorders, all these things need fluid therapy, so you can give regular lactate. So in large animal fluid therapy, the ideal fluid is the ringer lactate. Ringer lactate. Only you don't. That is only the concept. We will not go deep into the fluid therapy. You will get confused. Sometimes you may be giving normal saline 5 liters also. You will be giving because ringer lactate contains electrolytes. It contains potassium chloride. All GI disorders will have hypokalemia and dehydration will be there. So hypokalemia will be also corrected. So the animal also will be maintained. So that it will record. So we don't get confused. Fluid therapy in case of septicemia, so we will be giving fluoxetine, not more than 3 days, 1.1 to 2.2 milligram per kg body, and you can give normal saline and for correcting the dehydration with the electrolyte solutions, ringer lactate. Fluid therapy in case of EDS. EDS means animal is not passing the dung. Dung stasis is there. So when you are doing the rectal examination, you are getting some findings will be there. No? So tomorrow I will be telling the practical things. Suppose dung is scanty in nature, it indicates poor stomach disorder. Okay, poor stomach disorder. Complete absence of the dung. This indicates of intestinal obstruction. These two things. Complete absence of the dung, or only mucus alone is present, or raspberry jam like dung only is there, means it is a clear case of intestinal obstruction. Scanty dung is indicating of poor stomach disorders. So fluid therapy in case of EDS case means you can give ringer lactate and the oral administration of potassium chloride so that the animal cannot go down. So you can stabilize the animal. Then you can go for surgical procedures for interception. So fluid therapy in GI disorders and ringer lactate with the oral supplementation of potassium chloride. All abomasal disorders, intestinal disorders, poor stomach disorders, ringer lactate is more than. So need not go for dextrose. 20% dextrose, 50% dextrose, not at all warranted. They are warranted only in case of ketosis. That's all. Suppose if you want to give a case of energy conversion, you can give 1 or 2 sachets of DNS in such a case. And in DNS, they are not at all indicated in case of ruminal acidosis. In ruminal acidosis, the indicated food is sodium bicarbonate with the normal side. So fluid therapy in ketosis, 500 to 1 liter. 500 ml of ketosis D20 is more than sufficient, and no need of giving excess dextrose solution IV that will lead to hypophosphatemia. Oral propylene glycol or commercial preparations are available. And fluid therapy in case of nephrotisome disease. You should not give fluid therapy in case of anemia cases. That you have to take care. For example, the animal is having blanched mucous membrane. You are treating a case of diarrhea, deliciosis. You need not go for 3 liters or 2 liters of fluid. See the mucous membrane. Before going to the fluid therapy, we have to see 2 things. One thing is the mucous membrane. The mucous membrane should be normal, pink and moist. Okay. Number 2, you should not have any lung involvement, lung lesions. If it is having pneumonia, if it is having aspiration pneumonia, you have to avoid fluid therapy. So what is the main thing indicated in case of nephrotisome disease? Blood transfusion is the needed. The animal is blanched in mucous membrane. Blood transfusion is the ideal one. You need not go for. If you are going for 3 liters of fluid, then it will die. So that you have to take care. In such a conditions, you can go for plasma volume expanders, and you can go for oral administration of fluids. Suppose you want to give administration fluids, oral administration of fluids can be given. Fluid therapy in case of aspiration pneumonia and pneumonia cases, you should not give fluid therapy. If you are giving fluid therapy, then you will die. So it's not advisable. Fluid therapy, as I already told, in shock condition, 7.2% of hypertonic saline is excellent resuscitation in shock condition. So in fluid condition, what we should do now? The 20 ml syringe. You take the syringe and you take the plunger, you put sodium chloride, and 20 up to the 20 is measured approximately 30 weight. So 70 gram in 1 liter of normal saline. mix it and give it at a rapid rate. Then you can give oral administration of some 5 to 10 liters. Means the animal will, you can remove it from the shock. It's a shorter method for I mean, 7.2% means you have to mix 70 gram in 1 liter of water. So you take 70 gram of sodium chloride, mix it with 1 liter of NS and give it. That protein muscle is that no? Yes. That take up the pressure and that will pour sodium chloride up to that. That will measure approximately that be 25%. In ruminal acidosis, you have to the only the thing you will be giving sodium bicarbonate with normal saline IV and the ringer lactate. Sometimes in default you will be studying. Many people they will be saying ringer lactate is contraindicated in case of ruminal acidosis. It's not like that. Here we are giving ringer lactate for dehydration, correcting the dehydration. For correcting the bicarbonate deficit, we are giving sodium bicarbonate with normal. This is the two separate concepts. So you have to correct the bicarbonate deficit and correct the dehydration so that the result will be very effective in case of ruminal acidosis. So there is a formula just to identify for students. You can understand the formula. For practitioners, you can follow the thumb rule. So 0.3 into base deficit into body weight. This is the formula. So 0.3 into base deficit into body weight. That will give the milli equivalent of bicarbonate. Okay. So we are having a sodium bicarbonate decision here. So each ml contains 0.89 milli equivalent. Otherwise, it is equal to 1 milli equivalent. 1 ml is equal to 1 milli equivalent. You can divide it as a this base deficit is a constant, mild, moderate, severe. Mild, moderate, severe. Mild means animal walking condition, everything, intermittence, diarrhea. It's a mild case of acidosis. Staggering gait, incoordination, fluid passing sound, diarrhea, animal fell down. This is a moderate case. Animal unable to stand, animal is the lateral frequency, fluid passing sound. It's a severe case. So we tell it as mild, moderate, severe. Accordingly. So, for example, a cow which is having 400 kg of body weight with the ruminal acidosis, the heart rate is more than 120. Animal is recommend fluid passing sound. So, what will be the base deficit? It's a severe. So, 0.3 into 15 into 400 is equal to 1800 milliequivalent. So, how much ml you get? Yeah, 1800 milliequivalent, 1800 ml of sodium bicarbonate you have to. It's a needed in this case. So you cannot calculate in all the cases. So as a veterinarian, we should know from where we are getting this formula. So you keep this formula in your mind. Thumb rule, we can go for 1 to 2 ml per kg. Thumb rule 1 to 2 ml per kg. For example, 30 kg goat suffering from ruminal acidosis. So it's a mild case means 1 ml per kg. If it is a severe case means 2 to 3 ml per kg. Simple logic. So you can. So in small ruminants, don't give direct IV sodium bicarbonate. Rapid alkalization will lead to cholesterol damage. So in large animals, no problem. Even if you are giving directly, nothing will happen. In small ruminants, you have to mix it with normal saline and give it slow IV. In large animals, you can mix it with normal saline and they can give. There is no particular thing. This much amount we have to mix, nothing like that. You mix it with normal saline and give it. That's all. Correct the dehydration with ringer lactate. So that excellent result will be there in case of ruminal acidosis. Don't administer D20 or DNS in case of ruminal acidosis. So sodium bicarbonate, you have to mix it with the normal saline. Don't give overdose. For example, you are giving a sodium bicarbonate today. The animal recovered, but it is not taking feed. You have to keep in mind the point. Animal is in recumbency. You are treated with sodium bicarbonate. The next day you are visiting the test sodium bicarbonate. Many of the veterinarians what they will do. Sometimes, if the farmer says the animal is not taking feed, you will be repeating the sodium bicarbonate because already it is diagnosed as acidosis. So you should not repeat. What will happen when you repeat the sodium bicarbonate? Excess administration will lead to hypokalemia. The animal will go down. Then you have to treat it with potassium chloride. So for follow, you have to treat it with ringer lactate, fluid therapy, and the cut transplantation. Collect the rumen liquor from the healthy animal and the acquisition of the affected animal, so that animal become slowly become normal. So So overdosage should be avoided. No rapid infusion. Avoid fluid therapy in case of anemia, aspiration pneumonia, respiratory affections, pulmonary edema. Any cases of oral breathing cases, don't go for any fluid therapy. You would have heard about this one. This is available here. Amino acids. This is amino acid nutrition. Otherwise, you can use the human preparation. Amino acids are available. Suppose you are getting a dog meals a barber lentis, hypoproteinemia. This type of amino acids are available that you can use. And this is the bottle jar. Can you able to see the bottle-like structure? The submandibular region is a bottle jar. Bottle jar is indicative of hypoproteinemia. Okay. Loose tissue subcutaneous bottle jar is indicative of hypoproteinemia. Hard swelling from the mandible is indicative of actinomycosis. Sudden swelling of the mandible indicative of snake bite, hemorrhagic septicemia. All these things you have to know. So here soft fluctuating swelling is indicative of this is a case of angiostomes or liver fluid angiostomes. And in such a cases, you can go for administration of amino acids 2 ml per kg body weight, 2 to 5 ml per kg body weight. You can give IV. So it's it will supplement amino acids, and it will be treating it will counteract the hypoproteinemia. After the treatment, effective treatment, you can supportive treatment with amino acids. So this is oral degradation pumps. So you have to mix it all these type of electrolytes and you will be drenching like this one to reduce the fluid, parenteral fluid therapy. So you will be giving some 5 to 10 liters of fluid with electrolytes or purgative, whatever it is. There are different formulas are available and you will reduce the parenteral IV fluids. So it's very easy to administer. Large quantity of fluid can be administered to without any risk in case of anemia or like that. Only in aspiration pneumonia you should not go for oral administration. Already I used oral breathing. In oral breathing animal you should not put the stomach tube. Can you do that? Okay. So you have to avoid everything in case of oral breathing animals, parenteral or oral administration. So these are various formula I will give you. The sodium chloride, potassium chloride, sodium bicarbonate, 25 gram of benzoate mix it with water, and you can go for this all the ORS solutions. This is ORS in case of downers, potassium chloride with sodium acid phosphate, mix it with 5 to 10 liters of water, and you can drench it for downer foods, other downers. And this is ORS for impaction, magnesium sulfate with sodium chloride, we add liquid paraffin and drench it. So ORS for electrolyte supplementations. I will give you all these things to you. So just we have seen about the very basics. Just going on some idea though. What are the common drugs available? Some few drugs commonly used regarding our practice, so that we can have some idea. Okay. Thank you.
Thank you, Abdul, for contacting